part to interrupt. It got a little quiet in here. It is good to be in person. Good to see everybody. My name is Adriana Smith. I'm the president of MGMA. Really happy that you all are in attendance. I know June, July, summer months, it can be difficult. We've got kiddos out. We've got travel going on, things like that. But really excited that you all are here, especially since the speaker is my boss. So if it were just me, that would be great. But I just want to first off just welcome you all for being here and to be here, and thank you for your continued participation and support in MGMA. I also want to do a special thank you to Carol Miner. She's sitting at the table here. You mind, yes, just waving. She has left these wonderful bags and portfolios in everybody's chair, and she is the new HPD coordinator at St. Jude. So I know she's going to be trying to speak to a few of us after, and you can get in contact with her cards that have been left in all of the bags. But thank you, Carol. Thank you. Very appreciated. Also, I just wanted to let you all know before I introduce the speaker, we are skipping July, but August, right here, August 18th, we will have the Memphis Fire Department. They'll be coming and speaking to us just about all of the work they've been doing around 911 calls in the city, getting those answered, getting people to that need mental health support to where they need to go, people who need urgent care support to where they need to go. So a lot of work has been done around that. So hopefully you all come out here to Chickasaw August 18th. I think that's all of the announcements. So I get to introduce my boss, Dr. Scott Morris. Hopefully you all have heard of Church Health before, and if you have not, you're going to want to come take a tour of our fabulous space in Crosstown. But Dr. Morris, he's from Atlanta. He came to Memphis and started Church Health back in 1987. He is a minister as well as a doctor. He still sees patients in our walk-in clinic every single week without missing a beat, even on snow days. So he is always there and present, and he also leads our organization. He has been innovative in the way that we look at medicine, and he's going to have an opportunity to really speak to you guys about what we are doing and how we look at the whole person to deliver care in Memphis, especially looking at delivering care to our most vulnerable population and giving them quality care. So, Dr. Morris.
Thank you, Adriana. That will talk to me later about your raise. All right, y'all. So I first talked to MGMA 35 years ago. I was sitting around thinking about this. So when I first came to Memphis was the first time I talked to this group, and MGMA has been incredibly important to work in Church Health ever since. So what I am keenly aware of is, despite the fact we've been around for 35 years, a lot of you don't really know why I would be talking to MGMA and how Church Health works. So that's really my goal here. But just give you an overview of how Health came to be and our relationship, especially with the medical society. I grew up in Atlanta and was always interested in the church. But for me, the thought of preaching 52 sermons a year sent shivers down my spine, still does. E. Miller over here would probably disagree with that because I actually baptized her and grew up in my church. I'm embarrassing her now. But anyway, what I realized when I was a teenager is that a third of the Bible has to do with healing the sick. It is literally on every page. But if you look around and see what churches do, there's just not much to it. We pray for people on Sunday morning. The pastor visits people in the hospital, and there's not much more to it. All over this country, we have built hospitals that have church names on them, and this doesn't actually apply to Memphis so much, but for the most part, these hospitals have almost nothing to do with worshiping congregations. It seemed to me as a teenager that there ought to be more to it than that. So I set out to try to find a way that I could personally connect my career that would link faith and health. And what would that look like? You know, it was either that or pitch for the Atlanta Braves. And they never called me, and to this day I can't understand why. But I had to move on, so I go to college, I go to seminary, and I spent most of my time in seminary looking at what the church has historically done. And came to realize there is a reason these hospitals have church names on them, which we just forgot. So, not to give you a long song and dance history lesson, but if we just look at this country, prior to the Civil War, if you were sick, the most likely person anybody would have seen for health care was actually a pastor. Pastors provided virtually all the health care in this country, partly because they were the most learned person in the community, but also because they took seriously the fact that we're expected to care for our bodies as well as our spirits. So two examples of this: one, Cotton Mather, who most people think of as a hellfire and brimstone preacher in the colonial period. Mather actually initiated the notion of inoculation. He inoculated successfully the entire city of Boston against smallpox, and is considered to be the first significant figure in American medicine. So the fact that inoculation is actually fairly important right now, this whole issue of having a COVID vaccine, goes directly to Cotton Mather. Now, the other person who's near and dear to my heart, and I would hope at least some of you, is John Wesley. So John Wesley, the founder of the Methodist Church, actually thought of himself as a physician. He practiced medicine from the day he was 19 until he died. He wrote several books on healthcare. His book, Primitive Physics, which is a self-help healthcare manual, was so successful on the American frontier that as late as 1850, if we were in Memphis in 1850, there would have been a greater chance that you would have had a copy of Wesley's book, Primitive Physics, than you would your own copy of the Bible. Now, I fully confess, Wesley had some unusual ideas. He had at least 18 different cures for baldness, most of which I tried myself. My favorite is you take a big red onion, you cut it in half, you rub it on your head until it turns red, and then you put honey on it. Now, if that doesn't work, you could use Wesley's tried and true method for anything, which is you can electrify it. Wesley actually saw a demonstration of static electricity that was put on by Benjamin Franklin in London, and he was so enamored with the idea that he went home and in his garage, he created a little thing he called an electrifier. And if you read his diaries, he used it virtually every day. But it's not quite as crazy as it sounds. If somebody falls down dead right now, you probably want us to put a little electricity to your heart. But more to the point, in the 18th century, Wesley was the primary advocate against the use of polypharmacy. In the 18th century, it was generally thought the more drugs, the better. That sounds a little bit like the 21st century. Instead, Wesley believed you should use one drug for one problem. He was against leaching, quicksilver, bleeding. Instead, he advocated clean air, fresh water, more exercise. Now, he did think that riding a horse would cure almost anything. Wesley himself rode a horse 2 hours every day for almost 70 years. He even had a little thing that he kept in his living room. If it was just pouring down rain, he would go in there and bounce up and down on this, simulating riding a horse. Now, you may not think about this very often, but Wesley and George Washington are actually contemporaries. And if you know how Washington died, it's December 4th, he's walking around Mount Vernon, trying to decide which trees he's going to fell during the winter, and he gets sick. We now know he probably had something called epiglottitis. And they bring the best doctors in America to take care of him, and their collective decision was they bled him until he died. Now, had they called Wesley, he would have never let that happen. He would have gotten him up on his horse and ridden him around Mount Vernon. It might not have helped, but we wouldn't have killed him. It's just one of those things we have to always think, does the doctor really know what they're talking about? But I digress. All right, more to the point. Wesley believed that every Methodist society, and indeed every church, should be involved in direct, hands-on health care. For Wesley, it mostly had to do with the coal miners of Western England. But when he came to America, even though he was not a very successful evangelist, Wesley did not convert one person in the 2 years he was in America. his ideas around healthcare actually caught on. Until as late as 1863, a pastor in Guilford, Connecticut wrote the standard textbook of physiology for the entire country. So, what happened? Because what I just described is clearly not the way it works today, right? Not in your practice, not anywhere around us. So 3 main things I think happen. Number 1, the split between science and religion that comes about because of Darwin. You should never underestimate the influence of Darwin. It's been profound. We experience it literally every day. The second is during the late 19th and early 20th century, there was an explosion in medical science. Sadly, still no cure for baldness. But along with it, it was seen as being financially lucrative. It made sense to keep the clergy out. The truth is, the clergy were too lazy to keep up with all the new knowledge. Now, the third thing, and what I think is the most important thing, during the same time frame, late 19th, early 20th century, there was a reassertion of a philosophical idea that is Cartesian dualism. Descartes' idea that's a recapitulation of Plato. It says we can take a human being and separate us into a body and a spirit. You put the body on one side and say it's the purview of science and medicine. You put the spirit on the other and say it's okay for people of faith to mess around with our spirits, but heaven forbid and cross this line and care about our bodies. So that idea is a fundamentally non-Christian, non-Jewish, non-Muslim, non-Hindu idea. Every world religion out there fully rejects that idea. And yet, that idea rules the world. Now, I can give you many examples of how this works, but many of y'all can give your own. And every day, people go to the emergency room, complain of pain in their heart. And we do all sorts of tests. We do a cardiac catheterization, we might do an MRI, and the doctor then says there's nothing wrong. Because you can MRI somebody's chest all day long, and you will never know what a broken heart looks like. Now, being able to fix a broken heart with pills just doesn't work. Now, the other side of this, the least healthy meal you could eat every week is at a church. You know, our churches have blessed us in a gluttony for the sake of fellowship. In the midst of the obesity epidemic in America, clergy are 30% heavier than the rest of the population. You can't have a healthy church if you don't have healthy leaders. All right, so this is what I do while I'm in seminary. And then one day, I am in the chaplain's office at the Yale Medical School, and I look on his desk, and there's a little pamphlet that says, how to start a church-based health plan. And I go, that's it. That's what I want to do. I come to realize in the next few years, there's a lot of people who care about the link between faith and health. I hope I can count you as one of them. And then I steal the best ideas I can. I merge them with my own ideas. I finally am ready to start my own church-based health clinic after going to medical school, becoming a family doctor. And then I want to stay in the South. I don't want to go back to Atlanta. And then, not making this up, I read somewhere that Memphis is the poorest major city in America. And based on that, I say I'm going to Memphis. At this point, I was 33 years old. I was too young, too dumb to realize that what I wanted to do had no chance to succeed. So I come totally to Memphis, selling out of an empty cart, just knocking on doors, talking to people. And one of the first places I go is the Memphis Medical Society. This is how I end up talking to MGMA 35 years ago. Because church health is focused on how all of us can find a way to take care of the people who work to make our lives comfortable. That's who we care for every day. The people who cut your grass, take care of your children, wash your dishes, one day dig your grave. They don't complain, yet they don't qualify for anything. Surely you understand this. Y'all are in a position better than anybody, but if you are working in a minimum wage job, you're cleaning houses, you're cutting grass, you are not going to qualify for Medicaid or TennCare because the wisdom of our state legislature, we've chosen not to expand Medicaid. what you may or may not know is how the exchange works. So, healthcare.gov, I am a poor person working in a low-wage job. I go to healthcare.gov, I put my income information in, and if you qualify, what does that mean? It means your income has to be above 138% of the poverty level. Because if your income is below 138% of the poverty level, which is roughly $12 an hour for a family of 4, when you try to buy health insurance on the open market with the subsidy that comes from the exchange, do you know what it tells you should do? It says you should apply for Medicaid in your state. Only Tennessee has an expanded Medicaid. And what that means is the poorest people get nothing. So Church Health currently has over 70,000 people who depend on us for their health care. We're the largest faith-based, privately funded health center in America. There's a lot of disclaimers there. So, but 90% of our patients fall in that category of being below 138% of poverty level. So the poorest people get nothing. That is the situation we have in Tennessee right now. So, Church Health begins in 1987 trying to provide care for the people I just described. We are not a federally funded anything. Our attitude toward this is the government cannot do the work of people of faith, and neither should we ask it to. So we are not an FQHC. We're a true charity. Our goal is to see people who have nowhere else to turn. Part of what Adriana's job is to vet people before we were to ask somebody to volunteer to see our patient to make sure they don't qualify for anything. Your doctors are not volunteering to see our patients if that person could actually have health insurance in some other way. All right, we open our doors in 1987. Starts with just me, and then we grow. I need a partner. There's 2 of us, and then my partner has something that I generally just can't stand. It's called a husband. He takes her to Virginia. So overnight, I am now having to see 60 patients a day. I think y'all would all agree that's a lot for one doctor to see. So in the shower one day, I have a vision. And my vision is that I would go with the help of the Memphis Medical Society to primary care doctors all over the city and ask them to take patients into their own office to volunteer to see patients who fall in this category, working but uninsured, income below 200% of poverty level. Then we would go to subspecialists in every field who would donate their time. Every hospital, every laboratory would provide diagnostic testing, and when it was time to admit that patient, the patient would not get a bill. Now, the way a person would get enrolled would be through their employer. The cost would be $50 a month, at which point the employer has to pay at least $10. The idea was to call this thing the Memphis Plan, a joint venture between Church Health and the Memphis Medical Society. So in 1990, before many of y'all were born, we're ready to roll this thing out. And then I get a call from the Department of Insurance in Nashville saying that they had heard about it. It was a really good idea. There was only one problem. It was illegal. It sounded like health insurance. We didn't meet the rules to be an insurance company. So in my opinion, if you think something is really good, and yet you're told it's illegal, there's only one rational thing to do, which is change the law. So with the help of the Tennessee Medical Association, Blue Cross and Blue Shield, and the Memphis Medical Society, we were able to pass the Memphis Plan Act of 1991. All this law says, and we've been doing this since 1991, we've amended the law twice, is that anything that looks like what I just described to you in the state of Tennessee is not health insurance, which means we do not have to fall under the regulation of the Department of Insurance. So, what the Memphis plan allows us to do is to provide managed care for the uninsured. What most people would tell you is not possible. So rather than how it works all too often, this poor person can't afford a doctor, they wait till they get woe bad sick, they go to the emergency room, they get admitted or not, and then what are we supposed to do? The Memphis plan ameliorates all that. It gives that patient the ability to get the same quality of care you would expect your mother to receive. So, over time, Church Health has grown to where we have an array of physicians on our own staff. We also run a family medicine residency. And then we have hundreds of doctors who volunteer for us. If in your group, which I hope in every group represented here, there are doctors who are volunteering for Church Health. What I know intensely now is that we can't make this work without you. I mean, the doctor may want to volunteer, but if the group manager staff does not understand how Church Health works, then it creates enormous problems. So the things that I am hoping you will take away from this is that Church Health is not going to send you somebody who could go somewhere else. Number two, this person is almost certainly doing a job nobody else wants to do. An example, I see somebody this morning who 2 years ago, working, it's a long story who he's working for, but he's in an attic and he steps through the roof. He hurts his leg. It never gets addressed. For the last 2 years, this guy has been walking around on his toes like this, still working, because at that point, he has totally messed up his knee, and it never gets addressed. How is that not somebody that we want to help? I gotta believe that's somebody we all think wants to help. We need to help, but the coordination of it, how does that work? I am not an orthopedic surgeon. You know, we can start the process, but if we send somebody to your office, then this is why we're sending them. You know, or if we are asking your doctors to be a physician on the Memphis plan where you become the medical home for that patient, this is why, and it's how it works. Okay. Church Health moved to Crosstown 5 years ago. Just so you know how this works, the Sears Crosstown building was built in 1927. Sears built 10 distribution centers around the country. When you think about it, Sears was Amazon before anybody thought of Amazon. Somewhere along the way, they missed the memo. But out of the building at Crosstown in Memphis, anybody in a 5-state area that ordered out of the Sears catalog, it came out of our building. But the Sears business practices failed, and as a result, they quit publishing the catalog in 1992. Those of you who have lived all your life in Memphis, you remember this building because from 1992, it was a bombed out building. There were 3,200 windows. Every last window was broken. It was surrounded in barbed wire. It had gotten to be why would gangs strike anything else in the building? What more was there to say? And yet the building is larger than the Empire State Building. So every developer in the city tried to come up with a way to repurpose it. Nobody could figure it out. And then, on July 8, 2011, a young art historian, Todd Richardson, came to talk to me about the idea that he and his friends had, his artist friends had, of turning the building into an artist colony. So that is a financially viable idea, right? No, this idea has no chance. All he wanted at Church Health was for us to be their doctors once they moved in. What I say to him in 2011 is, well, what if we move in there with you? So I married one crazy idea with another crazy idea, and for the next 3.5 years, he and I become developers until where we have And now there are 48 entities that have signed long-term leases to be in the building. Methodist takes up an entire floor. Alsec takes up an entire floor. Church Health is the anchor tenant. We have 150,000 square feet in the building. There are 265 apartments. Every last one is rented. And it's amazing what $300 million can do to an abandoned building. As we've already heard, if you've never been to Crosstown or given a nickel tour, we would really love to offer that up to you. You know, there's a lot of people from Church Health here today, so talk to Andriana. These are my two Jennies. Jenny Robbins is the Chief Financial Officer. Jenny Bartlett Prescott is the Chief Operating Officer. We have a long list of former presidents of MGMA. This Jenny was one, along with Andriana. But I'm hoping that you will want to learn more about what we do. And I hope that you will become advocates for your physicians, to be volunteers for us. And once they are volunteers for us, help us figure out the enormous amount of bureaucracy that happens in medicine so that it becomes a better path. So let me just tell you one last story of how this works. So I see this guy who's 50 years old, who comes to our walk-in clinic. This is what I do. And he works in concrete. Pray you never have to work in concrete. So he's complaining of pain in his knee, and I x-ray his knee. Every last person in this room would look at that x-ray and go, that ain't right. He needs his knee replaced. So the beauty of the Church Health relationship, we have a number of orthopedic surgeons willing to do the surgery for free. So we're going to replace his knee, but I also need pathology, radiology, every other ology you can imagine. The hospital's going to waive the fee. What am I missing? A piece of metal we're going to put in there, so Smith & Nephew is going to donate that. Otherwise, he's going to get a bill for $10,000. So I'm ready to go. And I tell him, let's get your knee replaced. And then he asked me, will I have to miss work? You're going to miss work. We're replacing your knee, and you're going to miss some work. At which point he says to me, the duct tape works just fine. Now, nobody in America should have to duct tape their knee in order to go to work. That is immoral to even think about that. So here's what we do. We work with him through the summer in our physical therapy department where he can keep working. We replace his knee in January. We then continue to work with him for physical therapy so that next spring he can get back working in concrete. Now, this is what Church Health is all about. You know, I got to believe that you want to be a part of this because we're talking about our neighbors. You know, almost every person we care for is somebody who has touched the lives of people who look just like us. And I think this is what God's called us to do. You know, you don't have to ultimately, be a religious person to understand that this is what it means to be in medicine. Every last one of us in this room have chosen a career in medicine because we want to make a difference. You know, we want to find a way to make people's lives better, and we actually have the ability to do it. But I can tell you Church Health cannot do this without you. I can talk the doctor to volunteer with me every time, and if we don't have the cooperation with the office, then it's not going to work. So that's my plea to you today. Please come and visit us. And if anybody has any questions, I'm happy to answer them. Anybody?
So we've visited, I think, a few years ago, right after you guys moved in, and since then, and I think we did a cooking.
They cooked in the nutrition.
Yeah, right.
Yeah.
We could do that again. That's cool.
And when we toured, and you guys you had just opened up your dental clinic. So I mean, you've grown a lot even just since you moved into Crosstown. Just what's next on your horizon? I'm sure you're always planning something.
So part of moving across town is to grow into being able to care for more people. Our dental clinic now is the largest freestanding dental clinic in America. We have 24 operatories. We have 54 exam rooms, I think that's right. And so being able to take care of more people, that's our primary purpose. So it's not like we have to go build another crosstown. It is about how we can expand. But the reason we only have one site is because we have hundreds of sites, with particularly primary care doctors' offices being willing to volunteer. So yeah, so what's next for us is we got to do more. Anybody else?
What are your greatest shortages as far as needs and
Yeah, so where are our shortages? I mean, everywhere. Literally, there's not one subspecialty I can tell you that we don't need help with. That we need part of what we want to do is make it to where no one physician is asked to do more than they want to, and the more we can spread this around, what I love hearing is a doctor telling me, hey, you don't ever send me enough patients. I love hearing stories like that, but the only way we can do that is if we spread it around. So those of you who are now familiar with Project Access, Church Health works very closely with Project Access now, but it is not exactly the same. So Church Health is about providing full quality care for every patient we see, and working with Project Access, especially outside of Shelby County, that is where we are trying to find ways that we can work very symbiotically with the medical society as we move forward on this. What else? All right, Adriana, thank you for inviting me. I did not twist her arm. I did offer to be a speaker, but you didn't have to say yes. So.
Thank you for speaking.
All right, okay, thank you guys.
All right, well, if you all want to finish eating, please feel free to do so. We generally end around 1 o'clock. We have the room, so stay, eat, talk, network. August 18th is our next meeting here at Chickasaw. So have a great day.